I'm Sifu Slim, and I'm here looking at a bunch of books. The Drug Guide for Nurses, Diseases and Disorders, a Nursing Therapeutics Manual, Nursing Diagnosis, Medical Surgery, Surgical Nursing, Pharmacology for Nurses. What is this all about? Well, to find out more, I brought along someone who's in nursing school that's being inundated by these types of things. What he's not been able to do lately is exercise. I'm holding a weight, and I'm not a big believer in weights and machines, but I use this for my hip exercises. And a friend of mine doesn't have time for that currently because he's in nursing school. He doesn't have time to get his Walkman on and to get moving to the beat because he's in nursing school, and we've got to be inundated by driving to nursing school, hanging out in classes, being in the lab, being in the hospital, and then driving back home and studying all the time. It's really hard to get in a workout, according to Mr. John. So here's Mr. John, nursing student.
Yes.
And where are we, John? Tell us a little bit about what's going on with your life.
Where are we? I'm in nursing school, second semester right now, and yeah, that's pretty much it. I go to school and go home and study and eat and study some more and sleep and study some more and take care of patients.
So your wellness is where right now? Where would you rank yourself on a 1 to a 10 compared to when you were dancing more, swimming more, those types of things? Where would you rank your wellness and your sleep?
My wellness right now. Well, it's not a 10, and it's somewhere between 5 and 10. I could narrow
That's a
it
pretty,
down.
yeah, how about we narrow it down? Because I would say I'm right now, I've got some things from sitting all the time that I'm not a 10 either. But in terms of wellness, I feel like I could go out and swim like Jack LaLanne for a couple of hours. Maybe not 10 hours, but I feel like I could swim for a couple hours. Where do you rank yourself compared to when you were in better shape or in competitive shape?
Maybe 6 or 7, I'll say.
A 6 or 7 right now. Okay. And how is nursing school helping you with your own personal wellness?
Other than educating me to know things about medical conditions, yeah, it's not really helping me get out and get fit and exercise.
Okay, so
the way I like to.
What if you put all of these books in like a military surplus backpack with extra reinforcement, and you went out and jogged up a hill every day? Would that help?
Yeah,
that would be a really good use for these books.
It would, but then I'd be too tired to study.
You'd be too tired to study. That's what we run into. We are in America, according to lots of people I know, including people that have been born here in America, we're overeducated. We always have to get another credential. Because if we want to go from our $12 an hour without the big credential to our $40 an hour with a full credential, it's another 2 to 4 years of full-time work. And if you have a life, which is something that we used to have when we were human beings, not human doings, we actually might want to have a girlfriend. We might want to eat 3 meals, maybe not made, at Denny's and Arby's and McDonald's. We might want to spend some time with our mothers and fathers and our siblings if they live in the area, or our friends. Boy, wouldn't that be nice? We don't want to just wind up.
Friends are on Facebook. All your friends are on Facebook now.
That's it.
Yeah.
So
you can sit down in the comfort of your couch with your laptop or your cell phone and just Facebook interaction. That's your social life.
That's our social life. So we're digitally interacting with people in cyberspace. So we don't really need to go up and hug anyone anymore. We don't need to go up and sit down with them and hear what they're going through, good, bad, or in between. None of that's important because we can just Facebook them. We can get on LinkedIn and make all of our clients that way. Who needs to shake hands and catch germs? We can catch viruses right on our own computer. So why don't we just do stuff like that? Well, Sifu Slim is bringing us another message. Nursing school is a great way to buy a lot of heavy, expensive books. I'm going to guess that this book right here is a $60 book. Am I close?
That one's not quite that much.
What would you say this is?
The drug guides are usually in like the 30 to 40 range.
30. Let's talk about the prices of these books. Yeah. Do you know the prices? Maybe we can zoom in on some of these books in the hands that are
the thick ones are well over $100. They could be maybe close to $200 each. Some of these bigger ones.
And this is 1 year, or is this for all your years of nursing?
The thing is, when you buy all of these books, you get to use them for the whole course of nursing school.
Okay.
But then you do have to buy a couple more to get through. you have to buy them all up front.